What if your patients could hear your hormone philosophy reinforced by a second voice, even when you're not in the room? Well, you probably know there are lots of hormone influencers and menopause doctors on YouTube, but how often do you hear them say things like, normal is not optimal? Transdermal estradiol isn't always the best treatment for menopause symptoms. Optimal hormones can reduce or eliminate your symptoms, but more importantly, they reduce your long-term health risks at the same time. Well, that's exactly what My Simple Hormones YouTube videos do for patients. They reinforce your teaching about optimal hormones. Here's the challenge. Patients might forget or misunderstand some of what you tell them in your office visits. Sometimes they only remember the parts that maybe confirm what they already believe. Other times, they might go home and Google what you've talked about or ask ChatGPT. We'll talk in a later video about patient consults with Dr. Google. My patient YouTube channel serves as your second voice, reinforcing what you've already told them, and backing it up with clear, simple, trustworthy explanations. I cover the topics that you and I both know that your patients care about. Things like hot flashes and night sweats and weight gain from menopause, but also bone health and brain health and heart health. What about their fears regarding hormones and the long-term benefits of hormone optimization, topics they may have never even thought of? If a patient's worried about weight gain after menopause, maybe you could send her the link to my video playlist that's all about hormones and weight gain. This series of 4 videos describes the impact of high TSH, high FSH, and high insulin on belly fat, visceral fat, and postmenopausal weight gain. The last video in that series emphasizes optimizing estradiol in order to gain more control over all 3 of those other hormones. Maybe your patient is terrified of hormones because of something her other doctor told her. What a surprise, huh? So you might send her a link to this video that addresses her fears with both empathy and evidence. This isn't random go browse this channel homework. It's more targeted. It's intentional. And it's designed to reinforce your philosophy as a hormone optimization specialist, somebody who really understands exactly what to do with her hormones. The more your patient hears it from both you and from me, the more she understands it, and the more she trusts you as her hormone specialist. Sending YouTube links to your patients is an easy, effective way to reinforce your own teaching and to help your patient get on the same page with you about hormones. Doesn't cost you a thing. This approach does have its limits though. In an upcoming video, I'm going to explain a little bit more about a structured way to teach patients about hormone optimization. This approach builds patient trust, just like the YouTube videos do. It also helps her see you as the hormone expert who can guide her step by step through optimizing all her hormones. That's something her other doctor can't really claim because they haven't had the extensive hormone training that you've been through. This structured patient education system takes exactly 0 time on your part. Your patient can learn on her time, not yours. Watch my next video that explains the data about what patients are searching for with Dr. Google and the unfortunate answers that they're receiving. I'm also going to touch on the ways that ChatGPT and other artificial intelligence tools may actually be getting your patients even more confused than they were before. Click the link on this page to watch that next video, and I'll see you there.